Hello, my name is Daniel Cook. I'm a pulmonary and critical care physician and translational immunologist at the Vanderbilt University Medical Center in Nashville, Tennessee. I want to present to you the latest data on type 2 inflammation and cystic fibrosis as a predictor of mortality and as a target of CFTR modulator therapy. Cystic fibrosis is a common genetic disease due to mutations in the chloride bicarbonate channel known as CFTR. Loss of CFTR function leads to a multi-organ disease with pulmonary manifestations accounting for the major morbidity and mortality. To better understand the role of type 2 inflammation in the clinical outcomes of persons with CF, we interrogated our institution's research-enabled electronic health record. Within the EHR, we identified 483 adults with diagnostic coding for cystic fibrosis, including 316 with at least one instance of elevated absolute eosinophil count greater than 300 cells per microliter, or IgE level greater than 100 international units per milliliter, which we term type 2 CF. We also identified another 167 individuals without type 2 biomarker elevations, termed non-type 2 CF. We found decreased pulmonary function and increased burden of infection and allergy-related phenotypes within our type 2 CF population compared to non-type 2 CF individuals. Aligning with these observations, overall survival was significantly lower in type 2 CF than non-type 2 CF, despite both groups having similar demographics and age of first contact for CF care, with an adjusted hazard ratio for death of 2.24. Lastly, using linear mixed effects regression correlating CFTR modulator therapy with clinical laboratory test values, receipt of highly effective CFTR modulator therapy as defined by the triple modulator combination elexacaftor, tezacaftor, ivacaftor, or ivacaftor alone was associated with a mean 30% reduction of serum IgE levels. In conclusion, our study demonstrates a type 2 endotype exists within CF characterized by increased obstructive pulmonary disease and distinct phenotypic signature of increased allergic disease, infections, and burden of CF complications. Most importantly, we demonstrate for the first time an increased risk of death among CF subjects with type 2 inflammatory signatures compared to CF subjects lacking significant type 2 inflammation. Additionally, we found that CFTR modulator therapy was associated with IgE reductions, suggesting a complex relationship between CFTR function and type 2 inflammation for which further studies are needed. Thank you.